Good afternoon and welcome to the Assembly Committee on Commerce and Labor. Committee Secretary, will you please take roll?
Assembly members Anderson, present. Carter, present. Cole, here. Hardy, here. Howdigi, here. Kasama, here. Miller, here. Monroe Moreno, here. O'Neill, here. Roth, here. Torres Fawcett, here. Yeager, Urick, Chair Marzola.
And I am here. Please mark Speaker Yeager present once he arrives. Welcome everyone that is here with us in Carson City, anyone tuning in Las Vegas, and those listening to us over the internet. Today, I do realize that our agenda stated that we had 4 bills today, but we will not be hearing Assembly Bill 170. So we have Assembly Bill 215, Assembly Bill 399, and Assembly Bill 413. I will not be taking those in order. We also will conduct a work session to take action on measures the committee has heard in previous meetings. I do plan on holding the work session at the very end. Before we get started, I'd like to make a few housekeeping announcements. Member of the public may provide testimony in various ways, which are all listed on the agenda. When testifying, please remember to turn on your microphone to speak and off to listen, and also remember to state and spell your name for the record. If you have handouts for the committee, please provide 20 copies to the committee secretary prior to your testimony. Committee information is available on Nellis, which can be accessed through the legislature's website. You may also watch our meeting through Nellis or the legislature's YouTube channel. We ask that public comment be kept to 2 minutes so that everyone can be accommodated. As always, I expect courtesy and respect in all our interactions, even if we may not agree. Finally, please remember to turn off or silence all your electronic devices, especially your cell phones. And with that, we will move to hear our first Assembly Bill. I will now open the hearing on Assembly Bill 399. This measure requires certain health insurance to cover certain health care related to obesity. Welcome, Assemblymember Edgeworth. You may begin when you're ready.
Thank you. For the record, this is, I am Dr. Rebecca Edgeworth, and it's EDGEWORTH. Thank you, Chair Marzola and members of the committee. For the record, I'm Dr. Rebecca Edgeworth, as previously stated. I represent Assembly District 35, which is in Southwest Las Vegas, and I'm the sponsor of Assembly Bill 399. It's requiring that certain health insurance policies include coverage to treat and care for diseases and conditions caused by severe obesity through bariatric surgery. So I'm pleased to introduce my co-presenter, who is hopefully on the screen behind me. Dr. Ma is there in Las Vegas. She's going to come and sit at the seat. I'm going to do a mini introduction, and then she's going to give background information. We also have Mr. Chris Gallagher, who's through Zoom, and Dr. Morgan Pomerantz, who are going to be available for questions. So briefly, according to the National Institute of Health, obesity is one of the most challenging public health problems we have in the United States. It's a significant health crisis affecting more than 123 million people in the United States. It's between adults, children, and adolescents. So it's a very big problem. We need to take a multifaceted approach that focuses on prevention and treatment to improve the health and well-being of individuals that have obesity. As a physician, I've seen firsthand how devastating obesity is. I'm not personally a surgeon, but all of the things that come with obesity, including diabetes, hypertension, heart disease, disability, premature death, these are all things that can occur because of obesity. Obesity doesn't have an easy fix. Not every solution is good for every patient. Bariatric surgery is one option that's been tested over time and found to be very highly effective. It's never the first option that's given to people. There's lots of things that need to be done before that would happen, but it is very effective and should be available available to patients who are severely obese and who would benefit. Additionally, it's a very cost-effective solution because a lot of the data shows that after successful bariatric surgery, it reduces diseases like diabetes and heart disease. People live healthier, more productive lives. So now I'll allow Dr. Pearl Ma, to introduce herself and give us some background information. And there's a slide deck that we provided that has been uploaded to Nellis. Do you have the slide deck? Yes. Oh, I'm so sorry.
Do you know which one it is?
I can barely work the microphone. I definitely haven't worked the computer. That's wonderful. Thank you.
Absolutely. There you go.
Thank you, Dr. Ma.
Thank you for the honor and privilege of speaking today. My name is Dr. Pearl Ma, P-E-A-R-L. The last name is spelled M-A. I'm a metabolic and bariatric surgeon with my practice in California, but I'm the president-elect of the California and Nevada chapter of the ASMBS, which is known as the American Society of Metabolic and Bariatric Surgery.
I'm sorry, can you hold on 1 second? We have the wrong slide.
I don't think I can talk about that subject, so thank you.
Well, that's good because it's not on calendar anymore.
Great. I may not follow the slide deck exactly, so I can keep talking if that would save then for time interest.
That's okay.
As well.
We have the slide up. You can go ahead and begin.
Okay. Got it. Thank you. So I represent the Nevada chapter of ASMBS, which is the American Society of Metabolic and Bariatric Surgeons, and I represent over 175 bariatric surgeons. I also serve on the board of directors for the national ASMBS organization, representing thousands of bariatric surgeons nationwide. So thank you very much. I would like to just take a quick moment. Thank you for Dr. Edgeworth for setting that up regarding obesity. So just to put it in layman's term, obesity is a complex, multifactorial, very serious and relapsing chronic disease. It causes a state of chronic inflammation, which is why it's so associated with many diseases, more than 40 other diseases, including type 2 diabetes, heart disease, fatty liver, as well as 13 other types of cancers, associated with 1 in 5 deaths in the US as well. And the economic burden is quite large. It's up to $147 billion per year. Looking at Nevada specifically, Nevada currently has the 36th highest obesity rate in the country, with more than 30% of the population living with the disease and another 36% that are overweight. So altogether, that's about 66% of people living in Nevada who experience overweight or obesity. And so this legislation is a very important first step to ensuring that we have adequate treatment for all patients, especially in Nevada. So with obesity, you can see that's linked with a lot of medical issues. And so when we're able to treat that with using a multimodal approach, including bariatric surgery, we're able to reduce the patient's risk of premature death by 30 or 50% or so. In addition, we can cause a lot of medical issues to go into remission, such as type 2 diabetes, a 92% remission rate, which is amazing. And other things like dyslipidemia or high cholesterol, 76%, sleep apnea, about 96% remission rate, hypertension, 75%, and cardiovascular disease, 58% of that too. And on average, with people that undergo bariatric surgery, metabolic bariatric surgery, they are able to then maintain that weight loss of 60% excess weight loss 6 months after surgery and 77% of excess weight loss 12 months after surgery. So with that weight loss, they are able to decrease their inflammatory load and therefore have other medical diseases go into remission. And we know that metabolic and bariatric surgery is the most effective and long-lasting treatment for severe obesity. And this has been studied comparison with diabetes studies as well, looking at just medical treatment as well as just diet, intense diet and exercise. And we know that metabolic surgery can cause these diseases to go into remission much more so than just diet and exercise alone. And we have to understand that bariatric surgery is actually very safe. And when we look at the actual risk of death from actually doing the surgery itself, it's about 0.1% of risk of death, and overall likelihood of major complications is about 4%. So overall, that's much more safe than other commonly performed surgeries, such as getting a knee replacement. This bariatric surgery, a gastric bypass or a gastric sleeve, it's safer than getting a knee replacement, or even you're getting your gallbladder surgery done or your appendectomy. And so with that, the average cost of bariatric surgery ranges about $17,000, $26,000. But then because we reduce or eliminate a lot of obesity-related conditions, that leads to an estimated third-party payer will recover bariatric surgery costs within 2 to 4 years, and the healthcare costs are then reduced by 29% within 5 years of bariatric surgery. And so overall, I hope I can impart the importance of being able to do bariatric and metabolic surgery and allowing this for all of our patients in Nevada. And multiple medical associations agree that this is within the treatment arm of severe obesity, not just diet and exercise, as well as medications. The surgery is the most effective treatment, and we hope that we can provide this to all patients, as about 90% of patients nationwide already have access to this coverage. However, Nevada is not yet quite there for this. And so we hope that we can bring this to the patients to Nevada for this. So overall, bariatric surgery is widely covered by a strong majority of public and private health plans across the country. And however, many plans provide coverage. Some choose to place extra hurdles in the way of patients receiving timely access to bariatric surgery. So many insurance carriers have discriminatory patient requirements despite limited or no clinical evidence to support such requirements, such as mandated preoperative weight loss or an undescribed number of visits with a dietitian. If the patient hadn't even gained a single pound, which we all can do in a day or two, or even 5 to 10 pounds in a day, they may not allow bariatric surgery coverage for that patient. So these are very discriminatory things. So when we think about obesity as a chronic disease, just like cancer or diabetes, then we have to demand that these patients should be able to have access to care and treatment, just as cancer gets chemotherapy as well as surgery and a multimodal approach to their disease, which can be chronic. And so some patients get their surgery elsewhere, sometimes out of state, and unfortunately, some plans do not allow them to have further coverage to deal with some of the postoperative issues and lifelong treatment that needs to be with patients with obesity, because this disease can relapse. In addition, so with this, we hope that this committee will then take into consideration that it is considered ethically unacceptable and socially intolerable for these insurance carriers to impose demands that are not evidence-based before approving coverage of the patients for patients with chronic conditions, or impose limitations or punitive schema after treatment is initiated. So coverage for bariatric surgery should not be discriminatory compared to any other medically necessary surgical treatment. Legislation such as AB 399 is an important first step toward ensuring that all people of Nevada have access to evidence-based obesity treatment avenues. So with that, I will then introduce Chris Gallagher, who is the Obesity Action Coalition, who's our policy consultant, to introduce more of the bill. Thank you very much.
Thank you, everyone, and I appreciate the opportunity to testify for the committee. My name is Chris Gallagher, CHRISGALLAGHER. And again, I'm the federal policy consultant for the Obesity Action Coalition, and also provide the same services for the American Society for Metabolic and Bariatric Surgery. And I'll give you a quick walkthrough of the highlights of AB 399, which would require that certain public and private health policies, including Medicaid and the state employee plan, include medically necessary treatment and care, including bariatric surgery, for diseases and conditions caused by severe obesity under certain circumstances and with certain restrictions. This would apply to individuals 18 and older with severe obesity, and we define that as a BMI of 40 or higher, or 35 or higher with an associated complication, such things as hypertension, cardiac disease, sleep apnea, or diabetes. In addition, the bill provides for coverage of related preoperative and postoperative services, including without limitation psychological screening and counseling, behavior modification, physical therapy, and nutritional education. In general, this legislation aims to address discriminatory benefit plan language that some plans continue to utilize against patients seeking bariatric surgery, compared to how public and private plans address prior authorization requirements for other surgical interventions. The legislation also calls for the use of clinical guidelines for the treatment of the bariatric surgery patient, such as requiring said surgery to be performed in a medical facility that holds metabolic and bariatric surgery accreditation issued by the Joint Program of the American College of Surgeons and the ASMBS. In terms of prior authorization requirements, the bill would allow plans to utilize a number of reasonable prior authorization requirements, such as asking that the surgeon attest that the bariatric surgery is medically necessary and provided in accordance with the clinical guidelines from the ASMBS and the American College of Surgeons, and also require an insured person to successfully complete a preoperative period of not more than 3 months. That includes services recommended by ASMBS. I think Dr. Ma spoke to the fact that some plans have, 6 months, 9 months, 12 months of, medically mandated weight loss prior to the patient being deemed worthy of having bariatric surgery. The bottom line of this bill is it puts in some utilization management for health plans, but it also limits in terms of what a health plan can do that would really not be in accordance with any other surgical intervention. And I would be happy to walk through the proposed amendments for the legislation.
Please.
Sure. So I'm not an expert at legislative language, but in terms of, qualifications we would want to make under the section detailing conditions of providing coverage for bariatric surgery. And this, goes through, there's like 7 or 8, 9 sections where you have the same language. Right now, the current language states that an insurer may limit coverage for bariatric surgery and related preoperative and postoperative services to not more than 1 such surgery per lifetime. That should mean if we're doing new language, an insurer may not limit lifetime coverage for bariatric surgery and related preoperative and postoperative services to 1 procedure per lifetime. This is something that health plans continue to employ. Imagine having cardiac surgery and say you needed a stent put in, and then the health plan said, that's it, you're done. You've had your 1 cardiac procedure, no cardiac bypass for you, or, addressing cancer through surgical oncology. You can have maybe 1 surgery, say if you have breast cancer and then it ends up in the other breast, you can't have any more surgery after that. It's quite limiting. The other amendment we had deals with Section 5 under the prior authorization requirements. I believe it says this section does not require a policy of health insurance to include coverage for any drug that is injected to lower glucose levels or any other drug prescribed for weight loss. We think that provision should be taken out of the bill. There is no mandate that under this bill that plans provide medication coverage, so we don't think it's necessary to have that in the language. In truth, we really promote access to all obesity treatment avenues, from intensive behavioral therapy to obesity medication to surgery. It's a chronic disease and it's a very complex one, and patients need access to every treatment avenue. You can't basically tell someone to exercise and eat right if you're having cardiac disease, and then you have to wait until you're too sick to have surgery. You need options for everything. And I think in this case, we understand there might be some concerns about cost of GLP-1s. We understand the prices are too high. I know the Obesity Action Coalition, who I'm here for today, has spoken to that. The cost for these medications need to come down, but it needs to be, working with policymakers, PBMs, industry to work on getting better price points for these medications. Surgery has been, we're on our 20th anniversary of Medicare covering bariatric surgery, and as Dr. Ma said, it is quite safe and it is widely covered. But the question is that coverage real coverage? And we're hoping to address some of these discriminatory benefit designs through this legislation. Thank you.
Thank you. With that, we can open up to questions.
Thank you, Assembly members. Assemblymember Kasama.
Thank you. Thank you for the presentation. My question is, I just wanted to clarify, so this will bring in that the bariatric surgery will be covered by insurance, but the medications used for weight loss will not be covered by insurance. I just wanted to clear that up.
Thank you for the question, Assemblywoman Kasama. Rebecca Edgeworth for the record. This bill is meant to be focused on bariatric surgery, knowing that there are other modalities that are effective. We're not addressing the question of GLP-1s, which are the expensive medications that we talked about. This is just, it isn't to say that they're not good treatments. There's more evidence for bariatric surgery, and it's a good modality, and it's one we want to have everyone to have access to.
Thank you.
Assemblymember.
Thank you, Chair. Could you tell us what is the average cost of the procedure? And then if it's going to be covered by insurance, have you thought about what that breakdown would be? Would it just be the copay for the patient have to pay and the insurance pay the remainder?
Thank you for that question, Rebecca Edgeworth for the record. I'm going to phone a friend. Dr. Pomerantz or Dr. Pearl, do you have any thoughts on costs that are associated with bariatric surgery?
So the average this is Dr. Perlma, MA. The average cost of bariatric surgery ranges from $17,000 to $26,000. And whether that is performed in outpatient setting, depending on the insurance plan, or inpatient, the cost to the patient should be pretty minimal. Most plans cover majority of that. And so to, again, estimating that with the reduction of their medical issues, that's estimate about third-party payers will recover bariatric surgery costs within 2 to 4 years, and healthcare costs are reduced 29% within 5 years of bariatric surgery. Dr. Pomerantz, any comments?
Yes, hello. Can everybody hear me okay? I'm checking my audio.
We can.
Great. Thank you for having me. For the record, my name is Dr. Morgan Pomerantz, M-O-R-G-A-N, P-O-M-E-R-A-N-Z. I'm a practicing bariatric physician in Las Vegas, and I am the medical director of the bariatric surgery program at St. Rose Dominican Health Hospital's San Martin campus. In terms of cost, I agree with those statements. It varies between inpatient and outpatient, but they are overall comparable to the cost of other surgeries that are very commonly performed across the country. One thing I would like to add in terms of overall cost of this, not just the procedure itself, but that we have experience and data that shows that these are done not only safely, but also fairly quickly in terms of the average hospital length of stay. Average length of stay across the country for bariatric surgery is often 1 day or less, whether it's a gastric sleeve, gastric bypass, duodenal switch. We optimize these patients, and we have a very good enhanced recovery after surgery protocol that many hospitals perform with various variations. So the actual cost is very minimal considering they have a very short inpatient stay or even just an outpatient stay.
You mentioned the recovery and the accelerated recovery. What does that entail? And would that be covered as well? The procedure itself would be covered by insurance. Would all of the follow-up treatments also be covered? And what is is that inclusive of the cost of the surgery, or is that in addition?
So if I understand correctly, I mean, all the costs in terms of this enhanced recovery program.
Can you please state your name for the record?
Dr. Pomerantz again. So if I'm hearing you correctly, yes, everything is included in that cost, that bundled cost. These are, multimodal medications, narcotic and non-narcotic medications that are covered. In terms of the post-operative care, that's no different than much of the preoperative care, office visits, nutrition visits, and such.
And if I could interject.
Oh, apologies.
It's Chris Gallagher for the record. And again, that's, payment for bariatric surgery is over a 90-day global period. And, this legislation talks about postoperative and preoperative. And as we said before, for health plans that often wish to require 12 months of medically mandated weight management, those those requirements are in there, and the health plan tends to not pay for any of that. So it's one thing to make a patient go through 12 months of, trying to do what they've been doing for 40 years or 30 years unsuccessfully, and another thing to make them do it and make them pay for it. It's a very a major hurdle to care.
This is Dr. Perlma. To add on to the postoperative visits, the patients are generally seen every 3 to 4 months after the first year from the bariatric surgery, and then after annually every 6 months to 1 year for the rest of their lives, generally by that bariatric surgeon. And so those visits include a vitamin assessment, weight, nutrition, and diet and exercise, discussion with access to dietitians and a psychologist if needed. And those are usually a cost of an established type of visit. You would go in for your primary care doctor for, let's say, a flu or some other type of wellness check.
Dr. Pomerantz again. Sorry, just to add on quickly, the care that's often received pre and post-op, what we're finding is that a number of insurances are currently, even if they exclude the actual bariatric surgery, none of them are covering already preoperative and non-surgical weight loss visits. Visits with us for medical weight loss, visits with dietitians. It's the surgery, the procedure themselves that we are trying to standardize and get universal coverage for. So it's not I would say that it is not a major increase to add this on. It's not like we're trying to add on the payment for all of these other things. It's usually just the procedure that can vary.
Assemblymember Hardy.
Thank you, Chair, and thank you for this bill. Weight loss is a struggle for a lot of people, and, it isn't always just solved by going to the gym or cutting back on what you eat. So I appreciate this. I was just curious, I noticed on one of the slides, and you mentioned there's different types of surgeries like a gastric sleeve or a balloon and such. I was just wondering, how long does one of these surgeries last? Does it depend on like the age of the person or which one of these they do? If you could answer that. Thank you.
Hi, Dr. Pomerantz again. Great question. So a lot of different surgeries have come and gone over the years. Some things have fallen by the wayside based on our research and experiences. Balloons are not, and gastric bands are not commonly performed these days, but the surgeries that we are doing that are approved by the ASMBS and other bodies that, these are very durable long-term procedures. They are a tool to be used by the patient and along with us. But those that are receiving this postoperative care, those that are committed and consistent, the durability of these procedures don't have a limit. They can be maintained indefinitely in terms of their weight loss, the metabolic improvements, and improvement in these chronic disease states.
Dr. Perlma, just to add on to that, thank you. To give you an idea of the numbers that we normally do, about 60% of our bariatric surgery numbers are sleeve gastrectomies. So that's where we take 2/3 or 3/4 of the stomach away, making it into a banana shape. Gastric bypasses, we have declined significantly in that number, about 18%. Bands, less than 1%, because of bands needing a higher rate of revisions and such like that. But overall, the surgeries, to give you an idea, on average, 5 years after surgery, patients maintain about 50% of their excess weight loss long term. And one thing I didn't mention is why the bariatric surgery works. You can imagine with all the gut hormones, it's a metabolic surgery. And so we're naturally amplifying the body's ability to produce those GLP-1s, all those gut hormones that control metabolism. Your body naturally amplifies those abilities to make that. And that's why people are losing weight, the metabolism is faster, and the health benefits from that.
If I can just have a follow-up, how many times can a person have such a surgery?
So Dr. Perlma on that. So how many times? So I guess it depends on the type of operation. Generally, we would just do the one operation. and that would be all. Because of course, patients don't want to necessarily have surgery, right? We don't want to put patients under unnecessary risks. But there are some patients that come in with very high BMIs or body mass index, 70, 80s and such. And we're getting them to their goals. And sometimes we have to think about, can we do an operation first, a sleeve, and then something more metabolically aggressive, such as a duodenal switch, which is a kind of a sleeve with a more aggressive bypassing of the bowel to get them to their goal and to make it ultimately safe for them. And so the patients that are generally, where we're talking about weight, generally is just one operation that we aim for absolutely. If they do have complications, and remember some patients are getting these surgeries elsewhere and there's medical tourism that these patients we have to take care of as well, they may have complications and perhaps the surgery was not performed correctly. And that's why it's important that we ensure that we have some type of standard and we have centers of excellence that perform these operations. And so those complications may lead to another different type of operation or something else that's perhaps caused by the first operation or recurrence of their metabolic disorder that as time goes on. As you know, weight and medical issues kind of is a chronicity of that disease. So sometimes, things will be okay and then something happens and then the obesity gene is still there. And so we have to treat it as a chronic disease, managing it through medication, surgery, and such like that. But generally, our aim is for one, to answer your question.
Thank you. I appreciate that
Dr.
answer.
Pomerantz.
Go ahead.
Just to tack on a little bit, to address some of the unfair stigmas that have been out there regarding obesity and bariatric surgery, while this is elective and safe, this is, again, medically necessary for all these patients. This is not, despite some views, cosmetic. People don't come in periodically for touch-ups, tune-ups. We do sometimes need to provide revisional surgery in the cases of technical issues, insufficient weight loss or weight recurrence, gastroesophageal reflux disease, to name a few. Sometimes, but these are all medically necessary indications for revision, and we don't take them lightly. We aim for one and done if we can, but despite anyone's best efforts, both on our part and the patient, there are situations where it is medically necessary. But overall, the incidence of revisions are relatively uncommon.
Thank you. We will move to Assemblymember Cole.
Hello. Thank you for bringing this. I think it's an important bill. It's an important issue for our country as a whole. So my question is in Section 4, Sub 1B, where we talk about some of the related preoperative and postoperative services, and specifically the nutritional education. And it might be in other sections as well. But not all nutritional education is equal, right? And so my question is the intent here for this to be medical nutrition therapy as provided by a dietitian so that there's more optimal success rate, I guess, with what the intention of the nutrition is? Thank you.
Dr. Pomerantz, yes, we aim to have everyone evaluated by licensed registered dietitians in addition to ourselves. There is a variety of individuals involved in bariatric surgery, different practices. Some have more comprehensive setups, some may outsource to others, but typically, yes, dietitians are involved. Bariatric obesity medicine specialists are involved. Folks who are internal medicine folks or surgeons who are certified by the American Board of Obesity Medicine. This is part of the comprehensive approach that we like to use. I don't know if there was anything else that you were thinking of to avoid, but we try to have that and follow those standards.
Assemblymember Anderson.
Thank you, Chair, and thank you for the presentation. My question has more to do with a different area, and that's Section 15. You are adding in the possibility of Medicaid, so I'm just wondering how many other states are currently participating in this? And then if the language that you have in particular, Section 15, 6B, with the fully cooperate, if that is consistent with other practices that we have in this area when we're utilizing the Medicaid coverage.
Rebecca Edgeworth for the record. I could probably have Mr. Gallagher speak to this, but this language that the LCB came up with was based on recent legislation in Louisiana that just passed. We are one of the few states left that doesn't have something similar to this. There's a real trend towards that. Mr. Gallagher, do you have data on which states? I think you said 90%?
Yes, thank you, Chris Gallagher. For the record, yes, roughly, we have about 47 states where Medicaid provides coverage for bariatric surgery, and about 43 or 44 state employed plans provide coverage for the surgery. I think that we are moving with all plans to adopt, ASMBS criteria for bariatric surgery and address a lot of these issues with prior authorization criteria. I can't give you off the top of my head how many state Medicaid plans employ this same language, but I would be happy to get back to you and provide you with that information in a timely fashion.
Great. Thank you. Thank you, Chair.
Dr. Pomerantz, I would like to add on that in Nevada, we actually have, I believe, most, if not the majority, or all Medicaid plans currently covering bariatrics at the moment. This legislation is, number one, hoping to enshrine that, making sure that stays that way and protected. We are also focusing on many of the private commercial insurers that have outright exclusions currently.
Assemblymember Urick.
Thank you, Chair, and I want to thank my colleague for teeing up my question, because I also was trying to understand the breadth of the issue that we're trying to address. And so mine is less in the Medicaid area, but in the private health insurance. So I understand that most plans are covering some type of, or other modalities to address the issue of obesity. And what we're trying to do is direct, obviously, to hit this bariatric procedure. Do we have an idea of how many insurance companies now, just on their own, cover this type of procedure?
Rebecca Edgeworth for the record. Thank you for the question. I believe Cody Finney said that she would be here to address in neutral the fact that Medicaid is already covering it, but I don't know that I have numbers of how many private insurers, and of course, all private insurers aren't covered by Nevada. Some of them are federally tied, so I don't have control over all private insurance, but I can try to find that information out and get it to you. Get it to the committee.
Chris Gallagher for the record. We have from the American Society for Metabolic and Bariatric Surgery, their coverage database indicates that 90% of commercial payers, individuals who have insurance through the commercial market, have access to bariatric surgery. And again, I caveat that it sounds great, but there's still issues with hurdles that patients have to tackle.
Assemblymember Torres Fawcett.
Thank you, Chair. Thank you for the presentation. And I know that you stated that this piece of legislation is only inclusive of the bariatric surgery, but I'm just wondering what reasoning this wouldn't be expanded to weight loss medications. And the reason I state that is because there could be some concern, like if a patient knows that one service is covered, that would prevent them from maybe using a different service. And so if there's only one, and this is obviously a very invasive procedure, right? And I think that it really, obviously they should be given the choice to make this decision, but it shouldn't just be limited and restricted to the cost. So can you please explain why it's restricted to just that bariatric surgery?
Absolutely. Rebecca Edgeworth for the record. I'll just, if you would like to add, I will say, we wanted to keep this very focused. And the reason we're specific to bariatric surgeries, there's a lot more data. It's been around a lot longer. The cost effectiveness has been well proven with research. We have a lot of research to support it. It's not to say that GLP-1s don't have their role. I've been prescribing them for a long time for diabetes, but they're relatively new for weight loss specifically. We're just being narrow in our focus. We're not saying that GLP-1s are bad for you. I agree with you. I think all options that are evidence-based should be allowed to be participated in by the patient.
And Chris Gallagher, for the record, if I could add to that, in addition to representing the bariatric surgeons and the patients affected by obesity, I also represent the Obesity Medicine Association and the Obesity Society, which are folks who are doing clinical obesity medicine as well as obesity research. And as you'll notice from today, we're really not trash talking one treatment over the other. We all want all boats to rise. And I think the Assemblywoman is correct. And I've been doing this for 25 or 30 years. I've never seen such excitement about obesity treatment and so many people finally understanding what it's all about. And is it due to the GLP-1 craze? It is. That is both good and bad. We have people who are concerned about the high cost of these medications. We are working and trying to get industry to reduce their prices. But again, if this was any other chronic disease and you had behavioral options and you had longstanding surgical options and a new medication hit the market that could do basically what GLP-1s are doing for obesity, say for the chronic disease this new drug was addressing. I always think of like Hep C, very expensive, but that was covered. And I think, we just have to, it's a lot of bias and stigma. And the fact that we are sitting here going, well, maybe we can pay for one thing, but not the other. That's the problem with the bias and stigma. People do not see people affected by obesity as real people. Ever watch any kind of news story on obesity? It's always headless fat people. It's very stigmatizing, and we need to start looking at obesity as any other chronic disease deserving of every treatment avenue so patients have a choice. The reason this is really a surgery-only bill is the practicality of it, because so many people are worried about the cost, and they shouldn't be. We need to get the cost down, but frankly, you wouldn't do that for any other disease. We also work closely with the American, Diabetes Association. We do lots of things together, but that would be like telling the ADA, well, we're going to drop coverage or not cover GLP-1s for diabetes. No one would ever think of doing that, but it's always, fair game for people with obesity. Thank you.
Dr. Pomerantz, thank you, Chris. I just want to state that by no means do we want to give any sort of impression of bias here. We promote and we use GLP-1s and other medications as well for non-surgical weight loss solutions. But this bill, the way it's worded, is purely just logistics and strategy. We did not want to have the GLPs and the cost associated with them confounding this bill and just have everything being shot down just because of cost. It's just purely just a logistic issue. We already, whereas, bariatric surgery, as we're documenting here, is cost effective. So we just wanted to have that, just take care of one thing at a time.
Committee members, any additional questions? I don't see any. I do have one, just a point of clarification because I may be a little confused. So on your amendment, Section 1, subsection 5. At first, you had in the bill that it would not require health insurance to include coverage for any drug that injected to lower glucose. So would that be a GLP-1? Okay. And so then in your proposed amendment, you eliminated that section.
In our proposed amendment, we made it clear that this was simply about bariatric surgery as one option, and that this was not to also include costly medications that are very good, like GLP-1s.
And Chris Gallagher, for the record, we have suggested that amendment from the patient community, the surgeons, the medicine side, just because it's, in many cases, it wouldn't be included if this was legislation for some other chronic disease. It just continues to show unfair bias against FDA proven and approved medications for obesity.
Thank you for your response. I think that gives myself and legal a little clarity on your amendment. So with that and no further questions, we will move to testimony in support to Assembly Bill 399. Is there anyone here in Carson City that wishes to testify in support? Please remember to state and spell your name for the record. You have 2 minutes each.
Good afternoon, Chair Marzola, Vice Chair Hattigi, and members of the Assembly Commerce and Labor Committee. My name is Jacqueline Nguyen, Nguyen, and I represent the Nevada State Medical Association. We'd like to thank Assemblymember Edgeworth for bringing forth this bill. NSMA supports comprehensive and preventative health care for our patients. Obesity itself is a disease, and it's also a major risk factor for numerous other chronic diseases. Obesity impacts not just physical, but also mental health. Offering bariatric surgery as an option among many other pathways for weight reduction can reduce the long-term healthcare costs associated with obesity. We think management of obesity can lead to significant savings in the long term by managing or preventing chronic care diseases, hospitalizations, and expensive interventions in the future. Therefore, NSMA is in support of AB 399. Thank you.
Thank you, Madam Chair. Allison Herzik, last name spelled Herzik. I'm the Director of Nevada Government Relations for Dignity Health St. Rose Dominican. Dignity Health is in support. We, as Dr. Pomerantz mentioned, we have a very robust weight loss and bariatric surgery program, and that includes really intense consultation with the patients to decide if surgery is the right option for them. They also get, routine nutrition support, and we follow those patients after surgery as well. So, and just a quick point of privilege, I worked for a surgical office in Reno for many years, and they did bariatric programs, and I got to see firsthand the life-changing, outcome of this. So just really appreciate you taking the time to hear this bill today, and we want to thank Assemblymember Edgeworth for her work on this as well. Thank you.
Thank you for your testimony. Is there anyone else here in Carson City that wishes to testify in support? I don't see anyone. Is there anyone in Las Vegas wishing to testify in support to Assembly Bill 399? Broadcast, is there anyone on the line?
Thank you, Chair. There are no callers at this time.
Thank you. We will move to testimony in opposition to Assembly Bill 399. Is there anyone here in Carson City?
Good afternoon, Madam Chair. For the record, Ryan Beeman, representing the professional firefighters in Nevada, last name Beaman. Thank you for the opportunity to speak in support or in opposition of AB 399. I'm here today to representing the Firefighters Health and Welfare Trust. There's other trusts that are out there, kind of like ours, is also Metropolitan Police Department, along with like Teachers Trust that have these type of collectively bargained, self-funded nonprofit plans. With these plans, our mission is to safeguard the health and well-being of the first responders who dedicate their lives to protecting the communities. While the intent of AB 399 to address severe obesity through a mandated health insurance coverage is commendable, we must respectfully oppose this legislation due to the unintended consequences for our funds. AB 399 introduces an unfunded mandate requiring our trust to absorb the cost of expanding coverages without providing additional funding and subsidies. With our type of plans, we have to negotiate with our employer a dollar figure each time when we go to the negotiations table, and providing extra benefits and these type of things we have to really look at for our plan. Either then we have to either take a pay decreases to help fund these insurances, or we have to provide these benefits. So while we share the goal of improving our health outcomes for all Nevadans, we believe AB 399, as currently written, poses significant risk to the sustainability for our funds. We respectfully request that the committee consider the implications of this legislation and work towards a solution that balances public priorities. Thank you.
Good afternoon, Chair Marzola, members of the committee. My name is John Abel, John-Abel, and I'm here representing the LVPPA and LVMPD's Health Trust. Troyce and I sit on the board for LVMPD's Health Trust, and we do allow this surgery, but with rules. This bill aims to remove the rules, which would be very costly to our plan. And I also want to ditto everything that my fireman brother said as well. Thank you so much.
Hello, Chair, members of the committee. My name is Troyce Crumme, Troyce, KRUMME. I'm the current chairman of the Las Vegas Police Managers and Supervisors Association and the current vice chairman of Las Vegas Metro's Health Trust. We respectfully oppose this piece of legislation based on what was previously already said. I don't want to take any more of the committee's time. Thank you.
Hello, members of the committee. Ashley Kennedy, representing Clark County. And I do apologize to the bill sponsor because we did not have a conversation about this bill beforehand. I was actually in neutral with the bill as presented, but with the amended version that expanded the provisions of the bill, it is going to have an impact to Clark County's health plan. We are a self-funded health plan, similar to the trust funds that were described by fire and the police unions. So we are opposed with the amendment, and I will work with the bill sponsor. And I apologize for not getting a chance to speak to her. Thank you.
Is there anyone else in Carson City wishing to testify in opposition? Is there anyone in Las Vegas wishing to testify in opposition to Assembly Bill 399? Broadcast, is there anyone on the line?
Thank you, Chair. We have no callers at this time.
Thank you. We will move to testimony in neutral. Is there anyone here in Carson City wishing to testify in neutral?
Thank you, Madam Chair. Members of the committee, Adam Plain, Plain, with the Division of Insurance, testifying neutral on AB 399. I did submit written testimony kind of outlining some of the practical implications of the bill and what effects it may have on the fully insured market, addressing some questions, comments that were made during the bill presentation. Assemblymember Urick had asked about coverage amounts. I can say that 20% of Nevadans are insured through the fully insured commercial market. Of that 20%, it's 12% through the large group market, 8% in the individual and small group markets. Because gastric restrictive surgical services are part of Nevada's EHB benchmark plan currently, anyone's covered by those individual and small group plans should be having access to gastric restrictive surgery already. Large group plans are not subject to the essential health benefits benchmark provisions. Assemblymember Monroe Moreno asked about cost. I do want to say that now that we're in the insurance world, it is important to keep in mind the difference between plan benefit designs with co-payments, which are flat fees, versus co-insurance, which are usually a percentage fee. Surgical procedure might be a $500 co-payment or a 20% co-insurance, so that can vary greatly. Assemblymember Torres Fawcett had asked about restricting this provision to bariatric surgery. I will say that because it's part of the benchmark, which was set in 2017 before the introduction of GLP-1 and other medications, bariatric was the only real procedure in effect then, and we're limited with very big restrictions as to what we can do to expand that benchmark plan. If we wanted to explore GLP-1 inhibitors or other oral medications like metformin for weight loss, federal defrayal would absolutely come into play. There are a lot of very technical aspects of medical procedures versus pharmaceutical benefits. We'd be happy to work with the committee, with the bill sponsor, with anyone interested as to being able to work those out. And if there's questions, I would be happy to elaborate offline.
Good afternoon, Chair Mazzola and committee. Shelley Capurro, representing the Nevada Association of Health Plans, and which is a trade association representing 10 member companies that provide commercial health insurance and government programs to Nevadans. While we appreciate the intent behind this legislation, mandates often come with unintended consequences that can drive up costs for consumers and reduce plan flexibility. These increased costs ultimately translate into higher premiums, deductibles, and out-of-pocket expenses for employers and individuals. Additionally, mandates can limit consumer choice by requiring all policyholders to pay for required coverage that they may not need, reducing flexibility in plan options. As an association, we remain committed to enhancing healthcare quality and accessibility and welcome the opportunity to collaborate on policy solutions that align with legislative goals while ensuring Nevadans have access to affordable, sustainable health coverage.
Is there anyone else in Carson City wishing to testify in neutral? Is there anyone in Las Vegas wishing to testify in neutral to Assembly Bill 399? I don't see anyone. Broadcast, is there anyone on the line?
Thank you, Chair. We do not have any callers at this time.
Assemblymember, would you like to give any final remarks?
I'll keep it very short. Thank you so much, Rebecca Edgeworth, for the record. Thank you to the chair. Thank you to the committee for being so welcoming and kind. I really urge you to support this bill. I think it's important legislation. Thank you.
Thank you. I will now close the hearing on Assembly Bill 399. I will now open the hearing on Assembly Bill 215, which revises provisions relating to employment. You may begin when you're ready.
Good afternoon, Chair Marzola and members of the committee. I am Assemblymember Danielle Monroe Moreno. I proudly represent Assembly District 1, which is in Clark County, and I'm happy to be one of the sponsors of Assembly Bill 215, which revises provisions related to the employment of children. Joining me here today are my co-sponsors, Assemblymember Moore and Assemblymember Hibbets, as well as Tegan Clark and Carissa Murdoch from students from Shadow Ridge High School in Clark County. I truly believe that as elected leaders, we have a responsibility to be the voice of our constituents here in the legislature, as well as provide an opportunity for tomorrow's leaders to be actively involved and participate in the legislative process. For that reason, I continually engage in conversations with our youth and provide a BDR each legislative session addressing an issue that is important to them of how we can make change and make our communities that we live in a better place. And AB 215 is that piece of legislation that is by them, directed by them, and for them. Just a little background on AB 215. Child labor laws exist to keep our youth workers safe. Restrictions on the number of hours that youth can work serve the same purpose, while also helping ensure teen workers have time to focus on their development, educational opportunities, and health. Problems have arisen when scheduling managers and business owners are not aware of these restrictions. The federal government regulates youth employment primarily under the Fair Labor Standards Act, which sets minimum standards for conditions, hours, wages for teen jobs. Nevada also establishes certain standards for the employment of minors. When federal and state standards differ, the standards that provide the most protection to children apply. With certain exceptions, both existing federal and state law restricts the daily and weekly number of hours worked by children ages 14 and 15 in authorized employment. Federal law sets a minimum age requirement for employment and restricts the hours during which children under 16 years of age may work. Federal law also limits the time during the day which children ages 14 and 15 may work in authorized employment. Apart from working as certain managers, Nevada does not place restrictions on the times during which children age 14 and older, but under 18 years of age may work. As introduced, AB 215 aims to address the hours during which minors who are 16 years of age but under 19 years of age may work. With your permission, Chair, at this time, I would like to ask my co-sponsors to provide additional information. And then after they speak, we'd like to invite the two young ladies from Shadow Ridge High School to tell you their stories.
Thank you, Chair, members of the committee. My name is Brian Hibbets, and I have the honor of representing Assembly District 13, which for some unknown reason is right next to Assembly District 1. we'll figure that out later. So as you've seen me testify before, I like to explain how we got where we're at. So during the interim, I was invited to attend a group of government students with my colleague from Assembly District 1 because we share the constituency of Shadow Ridge High School. And while we were there, we were explaining, we were answering questions. What do you do? How do you do it? Why do you do it? And we explained we're all, crazy. And during this, they asked us, what are you working on? We said, no, what do you want us to work on? What is important to you? And that's where AB 215 came from. And I won't tell you the stories because I think that's for our guest presenters to do. But that's how we got to where we're sitting at today, along with some more information from our other presenter that will be here. Thank you.
Thank you for that. And by Chair Marsola and Vice Chair Howdigi and members of the committee, I'm Assembly Member Cynthia Moore, CINTHIAMOORE. And I represent Assembly District 11, which is in the heart of East Las Vegas. You may all be wondering how it is that I ended up working on this bill with folks who represent districts not anywhere near my area that I represent. But we got here similar to what my colleagues have said. They like to bring bills that represent their constituents, and that's how I got here today. I was approached by one of my constituents. He is a high school teacher in the heart of East Las Vegas, and he shared with me that many of his students are working extremely late. They're falling in class, they're falling behind. And he shared his concerns for his students because many are failing. And he approached me to see if I could help him and his students deal with this issue. And as someone that has lived in East Las Vegas most of my life, I have a son, I wanted to make sure that our students are protected and that there's a level playing field for them and they're able to graduate high school on time and that they're not working extremely long hours. And I'm just grateful that I am working on this piece of legislation that's bipartisan with my colleagues, and we will pass it on to the students.
Good afternoon. My name's Tegan Clark, TEAGANCLARK, and I'm a senior at Shadow Ridge. Throughout my high school years, I have worked consistently from my sophomore year through my senior year. The pressure of balancing school, extracurricular activities, and work has taken significant toll on my social and emotional well-being, physical health, and overall academic performance. At 16, finding a job with flexible hours and willing to take teenagers with minimal work experience can be challenging. One of the first questions hiring managers often ask is, what's your availability, or are you able to close on weeknights? Employers who penalize students for their limited availability place an undue burden on young workers, making it difficult for us to maintain a healthy balance between work and school. In my experience, working late shifts on school nights, sometimes until 10 to 11:30 p.m., has put me in difficult situations. Driving home alone at night as a relatively inexperienced driver has posed safety concerns. While my job provides meals for us during shift, my peers don't have the same privileges, forcing them to stay up later just to eat. The exhaustion from working late shifts has made waking up for school increasingly difficult, leading me to cut corners in my morning routines. Skipping breakfast, not making lunch, and wearing unwashed clothes from the previous day and rushing out the door has become my new morning routine. I would often find myself speeding to get to school on time, furthering putting myself and others at risk. Academically, my grades have suffered due to the lack of sleep. Struggling to focus in class, missing assignments, and failure to complete homework have all been direct consequences of my work schedules. I have not been able to perform at the best of my ability after getting 4 to 6 hours of sleep the previous night. Beyond academics, the biggest issue I have faced due to my work schedule has been the decline of my mental health and personal relationships. To combat exhaustion, I have turned to energy drinks, which only worsen my anxiety and physical health due to the caffeine content. The stress of balancing work and school left me with little time to build meaningful relationship with my peers and maintain a strong connection with my family. I have found myself isolated or unable to fully engage with my peers or enjoy social interactions. While quitting my job would have been the easiest solution, I needed to work to support my family. The financial responsibility I took on at a young age has made it difficult to eliminate work as an option. Moving forward, I ask that employers consider the well-being of student workers and implement more flexible policies that allow young employees to succeed both academically and professionally. Thank you for your time.
Hello, my name is Carissa Murdoch, and that's Karissa Murdoch. I began working at my job. I work at an ice rink. I started working there shortly after I turned 15 during my freshman year. I play travel hockey. I play in San Diego, so as you can imagine, that can get really costly, as well as I was turning 16 soon and wanted to drive. It all started by me scorekeeping games on Sundays and working in the skate room for weekend public skates through my freshman and part of sophomore year to earn money. And as I turned 16 and started playing hockey in San Diego and just got older, life became more expensive. I went to my boss and asked if I could be moved into the snack bar to get longer shifts and be able to work for tips. Eventually, I moved to the front desk, which is where I'm currently at. And with that came longer hours. I was working 6 to 8 hour shifts Monday through Thursday, which I still do. I was also in San Diego every weekend for hockey, so I pretty much was always busy. This resulted in me working until 9 p.m. on weekdays, which was not a big deal until the question that wasn't actually a question was asked. Can you scorekeep men's league after your shifts? Though it was never a question I was able to say no to, I obliged because I needed the extra money, but did not know what repercussions doing this would actually bring. Every night, the end of sophomore year and all of junior year, after I clocked out of my work day, my work night began. I usually kept score for 1 or 2 games a night and was not leaving the rink until 11 o'clock midnight each night. And by the time I got home, ate dinner, showered, maybe got around to some homework, and got to bed, it was always somewhere between 1:30 to 2:30 in the morning. From 6 a.m. when I woke up to 2 a.m. when I went to bed, Monday through Thursday, my day was jam-packed. I woke up, went to school, went straight to work, and went to bed on repeat every day. Well, at the time, I didn't think anything of it other than this is just what I had to do to make ends meet, and I didn't realize how bad it had truly gotten until I stopped scorekeeping. I went from a straight-A student who rarely turned in a late assignment, never slept in class, and had no trouble waking up for school, to an A and B student who almost never turned in an assignment on time, couldn't stay awake in class, and most of the time slept through my alarms in the morning. Not only was my work life affected, there was even a couple of times, don't tell my boss, but I did fall asleep at the front desk once. I began surviving off of Red Bull, coffee, and any other caffeine source I could find, and at night I was left to debate going to bed or finish my homework assignments. Usually I chose to go to bed. I was left rushing out of the house every morning because I wanted an extra 10 minutes of sleep. I was left sleeping in every single class, and I was left spiraling into a whirlpool of stress, exhaustion, and depression, waiting for someone to throw me a life vest. While I was not mature enough at the time to put my mental and physical health along with school success over an extra $50 a paycheck, I eventually came to my senses and told my boss I would not like to scorekeep anymore. As soon as I began prioritizing my health over money, I began able to stay awake in class, stop turning assignments late all the time, and I became much less stressed. I finally found the surface of the water I was looking for so long. I no longer had to debate if I should do my homework at night or go to bed, and I no longer slept through my alarm every morning. I actually felt rested in the morning, was noticeably able to focus in class again. I became much closer to the student and person I was before becoming a sleepless, caffeinated zombie. I came here today not only to speak out for the younger me who felt like she couldn't, but for all of my classmates, coworkers, and fellow high schoolers who are being taken advantage of by their employees. While some would say I should have just quit my job or said no, I couldn't. Most other jobs at high school students also resort to taking advantage of their young employees, and on top of that, the job search is nearly impossible. At 15, I self-admittedly was nowhere near mature enough to prioritize school over money, and wish the adults around me would have thought more about more than just using me for business gain. Thank you.
Chair Marzola, Danielle Monroe Moreno for the record. You've heard the stories of why we're here. And all of you know that a bill gets introduced and it doesn't always end up the way that it was introduced. So I'm going to ask you all to look at the amendment that should be on your desk. In processing, talking to stakeholders, my two co-sponsors and I made some concessions with the bill, and so today we'd like to focus on the amendment and not the bill as it was originally introduced. And I'd like to walk you through that amendment. Section 1 requires that the Labor Commissioner to prepare an abstract of the provisions related to the employment of children and to post it on the internet website maintained by the Labor Commissioner. In addition, the abstract must include a two-dimensional barcode, commonly known as a QR code, or other machine-readable barcode used for storing on internet address, and in the abstract relating to compensation hours, wages of employment that the Labor Commissioner must furnish to every employer in the state. And you may ask why that came up. That was a specific request for some of the students. Some of their managers are also young people. They may be 19 or 20 years old and not know the law. They're not always going to walk around with the book or go to training, but everybody knows how to use a QR code. So they specifically asked for a QR code that could be updated, and anyone could just look at it and know what the law is. So that's why that is there. Section 2 prohibits work between 11 p.m. and 6 a.m. This was a concession from the original 10 a.m. to 5 p.m. for some of the stakeholders. On any night preceding a school day by a child who is 1, enrolled in high school, 2, 16 years of age or older, and under 19 years of age, currently enrolled in the current academic year in a public, private, or charter school. And 3, not emancipated. A school district or juvenile court may grant an exemption from this restriction if it is determined to be in the best interest of the child. However, a performer in motion picture production, stage production, or theatrical performance, or work on a farm, lifeguard at a pool, or as an employee at an arcade is exempt from this provision. And the reason those exemptions were put in, we live in a town in Las Vegas that's a hospitality town, right? And a lot of the jobs on the Strip and in the entertainment industry, their work hours end at 11. And a lot of young people have those jobs and performance. And during the summer, even if you're in summer school, you might be a lifeguard at one of the resort pools or something. So that's why we agreed to that. The amendment also adds my two co-sponsors to this bill. Assemblymember Hibbets has been along with me since day one in this bill, and his name was inadvertently left off the original bill, and I apologize to him. And we were happy to be joined by Assemblymember Moore as co-sponsors. And with that, the 3 co-sponsors will stand for questions. We informed the young ladies, unless the questions were nice, we would not allow you all to ask them.
Thank you for the presentation today in this important bill. And I just want to say to Carissa and Tegan, thank you so much for being here today. I love having young humans in commerce and labor. It takes a lot to sit in front of us, and so thank you. I'm going to be mom for 1 second. Please don't speed and stop drinking energy drinks. But seriously, thank you for bringing this bill. I think that's very important. I think our job is to set up young humans to succeed, and it's bills like this that make it so. So with that, we will start with our first question from Assemblymember Torres Fawcett. I guess I still feel her energy. Assemblymember Carter.
Thank you. Listening to this, it's a great idea. What I'm concerned about, though, is my community. We have a lot of multi-generational, a lot of immigrant households where I talk to kids all too often that are doing cleaning offices and stuff in the time frame you're talking about, and this would make it to where their families would be short on food. That it's critical that a lot of kids in my community unfortunately have to work. And I'm trying to, how are we accommodating these tough situations in tough neighborhoods?
Cynthia Moore, for the record. Do I go directly or?
You can go direct.
Okay. Thank you, Assemblymember, for that question. I'm a fellow Eastsider, just like you are. My district is majority immigrant, first generation, just like myself. And I do realize, and that was one of the questions I did get from a lot of folks originally when I was working on this issue through a different bill. But at the end of the day, it's our responsibility as legislators to make sure that we are not setting kids up to fail. I understand that many folks in our community, the kids have to work as well because maybe the parents are undocumented, multi-generational. In my district, the median household income is $32,000. But we need to make sure that our youth doesn't fall behind, and not having that high school diploma is already setting them up much more behind than maybe their peers in other parts of the state. But I understand your concern. My very first job, I was 14. I worked at that indoor swap meet on Eastern and Pecos, selling CDs, Mexican music, rancheras, regional, all of that. But I worked only the weekends. I worked Friday after school, all day Saturday, all day Sundays. But also being mom here, we need to make sure that our kids are set up for the future. And I think my constituent is in Las Vegas, and he can share a little bit more about his students also want this as well, and they're Eastsiders.
Assemblymember Cole.
Hello, thank you for being here today. So my question is, there are certain high schools, and I don't know how many there are, but I know that there are at least a couple of high schools that are online. And so there's much more flexibility for those students to be able to schedule when they do their schoolwork versus what a traditional brick and mortar school does. So I'm just wondering if there could maybe be a carve out for somebody who's in an online school so that they can adapt their own schedule.
Danielle Monroe Moreno, for the record, I believe by including the charter schools, because generally those are charter schools, public charter schools that are online, they are included in here. However, the hours that we are suggesting that work be prevented is from 11 p.m. to 6 a.m. I don't believe there's any child that should be working between 11 p.m. and 6 a.m. I don't care what form of school they're attending. I'm a mom, I'm a grandma, and I'm a parent of an educator. So I just feel the 11 p.m. to 6 a.m. is reasonable. I really like the 10 a.m. to 5 a.m., but we wanted to get folks to support and not opposition, so we made that concession.
So my question also is related to how they schedule their school day. They might be doing school on Saturday or Sunday, and so you have it tied to immediately preceding a school day. So if they do school the entire week, do you know what I mean? They wouldn't be able to work at all.
So Danielle Monroe Moreno, for the record, and that's why we simply put their school day. If that is their school day, then it has to be in conjunction with their school day. We didn't put Monday through Friday.
Assemblymember Hardy.
Thank you, Chair. As a former small business owner that employed many high school students, I appreciate this. We were always very mindful that, school came first, and we wanted them to be home and safe and be able to get to school every day. And so I appreciate where this is coming from. So I just wanted to clarify, this is only during, as it says here, like the school year. So, like summer, weekends, as you mentioned, that's, that wouldn't apply. The bill wouldn't apply for that. And then I was just curious on where you're talking about the school district or juvenile court. How would that work? Is that like the student or the parent is going to request that? Or I was just curious about that exemption, how that would work.
Brian Hibbets for the record. I'll take the first part of that one, at least. The way the laws, or the way the bill is written is if the child has school the next day, therefore, if they're in a traditional 9-month school during the summertime, they wouldn't have school the next day, so it wouldn't apply. However, if they're in summer school because they need to catch up on credits because they've been working all night and failing their classes, well, then it would apply. To some member Cole's question, it goes towards that child's schedule. And do you want to handle the juvenile part?
Danielle Monroe Moreno for the record. I believe you're looking at Section C of the bill. As far as the school district or the juvenile court may grant an exemption for the restriction, that would go along in the lines, and we have legal here. I'm not an attorney. I play one on TV, but I'm not an attorney. If a child's been emancipated, they may be 16, but emancipated, and they're taking care of themselves, then that decision could be made.
Does that answer your question, Assemblymember? Assemblymember Miller?
Thank you, Chair. My question follows up to my colleagues about just the differentiation between, I appreciate that it's per each student's situation. An Assembly member, as you mentioned, summer, if they're in summer school, that's one thing. But what is the differentiation between traditional summer break when students aren't in school and actual school year? Because it does state that there's, what is it, up to 48 hours in any 1 week.
Danielle Monroe Moreno, for the record, it's 40 hours, which is a regular work week. And during the summer, that student could work at any time to make that 40 hours. We wouldn't penalize a student and tell them they couldn't work during the summer. This is to make sure that our students stay on track during their academic school year.
Follow up, Chair? Okay, so the only thing we're restricting is, and I'm saying this because my personal background, when I grew up, there were so many hours we could work during the school week, and then of course more hours during the summer when we weren't working at all. So this isn't restricting the hours, just the hours of the day, not the amount of hours in a week. Is that correct?
Danielle Monroe Moreno, for the record, during the academic school year, it's 40 hours a week and not between the hours of 11 p.m. and 6 a.m.
And during the summer, it's?
They can have as much fun as they want, making as much money as they can to earn money for their school clothes, help their families out, and vacations.
Okay, thank you.
Committee members, any additional questions? I don't see any. So we will move to testimony in support to Assembly Bill 215. Is there anyone here in Carson City wishing to testify in support? Please remember to state and spell your name for the record. You each have 2 minutes. You may begin when you're ready.
Thank you, Chair. Elliot Mallon for the record, E-L-L-I-O-T, last name Mallon, M-A-L-I-N. I've known a lot of you for a long time, and I think one of you have met my parents. I grew up in Assembly District 4, Assemblymember Cole's district. When I was a junior in high school, my dad went blind. When I was a senior in high school, my mom was diagnosed with breast cancer. I went to Centennial, a rival of Shadow Ridge. I was a wrestler. I ran track and field. And I could no longer do that because I had to help provide for my family too. I didn't intend to testify today, but this is personal for me because I've been in their shoes. So I fully support this, and I thank the Assembly members for bringing this and the students for coming up here. Thank you very much.
Good afternoon, Chair Marzola and members of the committee. My name is Kayla Mayese, spelled K-A-Y,
L-A-H, last name is M-A-E-S-E. I'm a civil rights analyst at the ACLU of Nevada. The ACLU of Nevada does support this bill, but a little backstory. I started my first job at 16, and similar to what the two wonderful young ladies were talking about, it's hard to convince a 16-year-old that school is more important than money. Luckily, I had my parents. They're fantastic. They're wonderful. They always made sure that I understood that school came first, and it will always come first. But in the light of being a 16-year-old working, if my boss asked me to stay till 11:30, of course I was staying till 11:30 to make more money. So it's really important that we put this legislation in place so that young students, young people getting into the workforce aren't getting taken advantage of. We have our whole lives to work. I wish I realized that at 16, that I do have my whole life to work. But we thank the bill sponsors for bringing this forward, and it's really great to see two young women coming up to the legislature, speaking and sharing their stories. So the ACLU proudly supports this bill. Thank you.
Hello, my name is Teresa Benitez Thompson. I'm here today in my own personal capacity, not in any staffing or any other capacity, just here myself as Teresa. And I'm here because I saw this bill and I loved it. I love it. Let me use present tense because I wish we had had this bill in 1995 for a 16-year-old Teresa Benitez Thompson. Well, then just Teresa Benitez. I was not married at 16. That would be a different hearing. But I was a hostess, and I worked at a chain that sold pies, and I was an amazing hostess. I killed it. They wanted me to work all the time, and I did my junior year, and my grades suffered. I failed classes that year. I had to go to summer school, but I just didn't understand the big picture of how important education was at the time. Probably where I understood it most was the beginning of my senior year, and after I'd spent the summer trying to do all this credit recovery so I could graduate on time. And the first day of my senior year, my boss asked me, hey, can you stay past closing again, which was past 11, because so-and-so didn't show up. You're so dependable. You're so reliable. And I was like, I have to quit or I'm never going to graduate high school. Like I knew what was going to happen that same senior year, and I knew I didn't have a chance to recover from it. And this was despite the fact that my mom was a waitress, so she was working late at night making tips. There were 3 of us girls that she was supporting on those tips, and I'm the eldest of 3 girls. So my younger sister, Maria Elena, who was only 15, at that point already had a 1-year-old son. So my money was paying for all of our school lunches, it was paying for baby clothes, it was paying for food, and it was important. But I think to Assemblyman Carter's question, the thing that is important is a low-wage job for a teenager is not going to solve poverty. Education is what breaks the cycle of poverty, and education is absolutely what has to be prioritized. So thank you for letting me come up here and say how much I appreciate and enjoy this bill.
Aloha, Mabub Hai, Madam Chair and esteemed committee. My name is Maria Teresa Hank, M-A-R-I-A-T-E-R-E-S-A-H-A-N-K. I am in full support of this bill as a proud Asian American Native Hawaiian Pacific Islander. A B in my community is an F. So I do support this bill, and I think it's so important that our children and Americans, that we realize how important education is. So thank you for this.
Good afternoon, Madam Chair, members of the committee. For the record, my name is William Horn with Western Public Affairs, representing Goodwill of Southern Nevada. As you know, Goodwill has training modules, and while they don't do these training modules for instance, CNAs and medical assistants, we all know there are 18-year-olds in high school. And there are educators on here that know that there are 18-year-olds that have just 1 or 2 classes their final semester in school, right? But this bill here will remove some obstacles that would prohibit them from being successful. And that's what Goodwill would want from any of their students that come for these type of trainings, to have the best opportunity to be successful in the classes they take there and go on to their careers. So we support this bill. Thank you.
Good afternoon, Chair Marzola, Vice Chair Hadigi. My name is Wesley Harper. I am the Director of Government Affairs for the City of North Las Vegas. We are in support of this bill. This bill helps create an environment that is healthier for the youth of our city, therefore strengthening our city, which is why we are in support. Thank you.
Is there anyone else in Carson City wishing to testify in support? I Don't see anyone. I see people already in Las Vegas. Please remember to state and spell your name for the record. You each have 2 minutes.
Thank you, Chairperson Marzola and committee members. For the record, Coach Matt Niswonger, Nighswonger. I'm representing myself today. I also really want to start out and say I have the privilege of being Tegan and Carissa's teacher. I want to thank them for their bravery and being willing to share their stories today. And really thank you again to the Assembly members, Monroe Moreno, Moore, and Hibbets for giving them a voice in this topic. I'm here to testify in favor of AB 215. Carissa and Tegan are standing up for so many of the teens throughout the state. They are part of the exploited high school workers across Nevada. Every single day in my classes, I have students who are too tired to participate in class. When I try to wake them up and ask them why they're so tired, they tell me they had to close or had to work late last night. Many of them have to work until 1 or 2 a.m. in the morning. I also have students who ask me to leave class early because they are scheduled to work during the school day, even though they aren't done with their school day yet. The business community needs to be our partner in educating our youth. They need to stop taking advantage of this vulnerable group of young workers. Tegan and Carissa are some of the very few who were even willing to share their stories with me. Many of my students and students at Shadow Ridge were worried that they would lose their job if they told their story. Several students wouldn't even write an anonymous letter regarding their experience. I have submitted some exhibits of some of the students at Shadow Ridge who were willing to share their letters. I asked the seniors at Shadow Ridge this year to do a short survey. And Shadow Ridge, if you're not familiar with Las Vegas, we are in the suburban ring, and we have a start time. The late bell for first period rings at 7 a.m., as do all comprehensive high schools in Clark County now. Out of the group of workers at Shadow Ridge, 9% of the seniors work every single night on a school night past 10 p.m. Another 13% work past 10 p.m. 1 to 2 times a week, and another 26% work after 10 p.m. every once in a while. So at a school like Shadow Ridge, overall 48% of the seniors with a job are regularly working after 10 p.m. on a school night. As a government teacher, I try to teach my students that the government is here to protect its citizens. AB 215 helps protect our exploited high school workers. Thank you.
Good afternoon. For the record, my name is Eric Van Houten. That's ErikVanHouten, and I'm the assistant principal and government teacher at Akipo Academy, a public charter school in East Las Vegas. I'd like to start by thanking my representative, Assembly Member Cynthia Moore, for hearing my idea and advocating for this piece of legislation to better protect our kids. A problem I've seen in my classroom and certainly in other classrooms is sleepy high school kids. Like any good teacher, they would ask why their student sleeps in class. More often than not, students sleep in class because they work late. Not having adequate sleep in school leads to poor grades, tardiness, mental health challenges, and difficulty concentrating. The solution to address this is Assembly Bill 215. What Assembly Bill 215 is looking to achieve is not revolutionary. When I was researching this idea to put a limit on how late students could work, I was surprised. 49 states have limits on how late kids under 16 can work, except one. That one state that doesn't is Nevada. It's time for Nevada to get on board. At Akipo Academy, students polled their classmates and found that 25% of 16 and 17-year-olds hold jobs. Of those students, 1 in 5 work over 40 hours each week in addition to being full-time students. Half of those students finish work past 10 p.m. or later on a school night. These students are ill-equipped to advocate for themselves to leave work at reasonable hours, and many of them are holding their very first jobs. If we are going to work to ensure our students are safe and well and college and career ready as a state, we need to put guardrails in place to protect our kids and make clear that a high school education should be their #1 priority. Assembly Bill 215 looks to solve this, and for that, I support it, and I hope you will too. Thank you.
Good afternoon, Chair Marzola and members of the committee. I'm Christian Solomon, ChristianSolomon, and I'm the West Regional Director of RISE. RISE is a Gen Z-led issue advocacy organization for college students and youth. I want to start by thanking Assemblymember Monroe Moreno, Hibbets, and Moore for presenting AB 215, as well as the students from Shadow Ridge High School. I'm speaking in favor of this legislation because this bill is a safeguard for our working youth against abuse from employers. Our students deserve to work and still be able to maintain their academic goals and personal livelihoods. Since 2021, there have been over 60 plus pieces of legislation introduced in 28 states to further roll back child labor protections to include letting young children work in hazardous occupations. This push nationally to turn the clock back into the Gilded Age is an unrealistic burden on our youth who are still trying to receive an education and set the foundation for their future. I am thankful that with AB 215, Nevada can lead and take a turn in the right direction to provide dignity to our youth who are employed just trying to make a living and balance their life priorities the best way that they can. Thank you for your consideration, and please support AB 215.
Thank you for your testimony. Is there anyone else in Las Vegas wishing to testify in support? I don't see anyone. Broadcast, is there anyone on the line?
If you would like to testify in support of Assembly Bill 215, please press *9 now to join the queue.
Good afternoon, Chair and honorable members of the committee. This is Ashley Dodson, for the record, ASHLEYDODSON of Anchored Perspectives, on the behalf of NAACP Las Vegas Chapter 1111. We are in strong support of Assembly Bill 215, which seeks to establish reasonable restrictions on the employment hours of high school students. As a former high school student at Advanced Technologies Academy, I do know firsthand the consequences of an overloaded schedule. While maintaining a full-time job, participating in sports, achieving over a 4.3 GPA, I struggle with extreme fatigue and inadequate sleep, working extreme hours. This nearly prevented me from walking across the stage at my own high school graduation ceremony. As for the last 2 months of school, I took my job more seriously than my academics. Thankfully, because of some teachers and counselors who had my personal number, they urged me to get back into class and pushed me to get across the stage. The limitations proposed in this bill will provide critical protections for students, ensuring that their pursuit of financial independence does not come at the cost of their education or health. The NAACP Las Vegas Chapter 1111 is committed to advocating for policies that protect and uplift the youth in our community, particularly students of color who are disproportionately impacted by economic hardship and the workplace exploitation. We urge the committee to pass AB 215 and support the well-being of Nevada's youth. Thank you, Assemblywoman Danielle Monroe Moreno, co-sponsors, and the amazing students for taking the time to give their testimony. Thank you.
Chair, there are no additional callers choosing to testify at this time.
Thank you. We will move to testimony in opposition to Assembly Bill 215. Is there anyone in Las Vegas wishing to testify in opposition? I don't see anyone. Is there anyone in Las Vegas wishing to testify in opposition? Broadcast, is there anyone on the line?
If you would like to testify in opposition to Assembly Bill 215, please press *9 now to join the queue. Chair, there are no callers choosing to testify at this time.
Thank you. We'll move to testimony in neutral. Is there anyone in Carson City who wishes to testify in neutral? Please remember to state and spell your name for the record.
Good afternoon, Chair and members of the committee. My name is Peter Saba, S-A-B as in Bravo A, and I'm the Senior Government Affairs Manager for the Nevada Restaurant Association. We are testifying in neutral today. We appreciate AB 215 and the thoughtful approach taken by legislators in engaging with high school students to shape policy. It's great to see young people's voices directly influence legislation, and I'd love to see more lawmakers do this, especially the ones who have my alma mater, the Law and Political Leadership Academy, Canyon Springs High School. We support efforts to balance student well-being and academics with valuable work experience. Many restaurants rely on student workers, and we encourage ongoing discussions to ensure these small businesses can adapt smoothly. The association is committed to educating our members on the proper hiring of students and the guidelines that come with it. We look forward to working together to support both young people, young employees, and the businesses that help them get their start. Thank you.
Thank you. Is there anyone else in Carson City wishing to testify in neutral? Is there anyone in Las Vegas wishing to testify in neutral to Assembly Bill 215? Broadcast, is there anyone on the line?
If you would like to testify in neutral for Assembly Bill 215, please press star 9 now to join the queue.
Good afternoon. My apologies. I missed the time for testimony in support. So this testimony is in support. Is that okay?
You can go ahead. We'll move back to support testimony.
Okay. All right. Thank you. So, Chair Marzola, esteemed members of the committee, my name is Chandler Cooks, ChandlerCooks, and I'm in strong support of AB 215 because it's time we ask ourselves the hard question. What's the cost of a paycheck if it comes at the price of a student's future? Far too often, and as you've heard from many of the testimonies today, young people are forced to choose between their education and their financial responsibilities. Students leaving late night shifts, exhausted and overwhelmed, are walking into classrooms the next morning without the energy or focus they need to succeed. That's not just a burden, it's a barrier to opportunity, and students shouldn't have to jeopardize their education to make ends meet. This bill is truly a lifeline for students caught between responsibility and opportunity, and it says to our young people, your education matters, your well-being matters, your future is worth protecting. And as we strive to build a stronger Nevada, that future depends on ensuring that no student is too tired, too stressed, or too overworked to unlock their full potential. So I urge this community to support AB 215 because no child's academic success should depend on their ability to survive a late night shift. Thank you.
Chair, there are no additional callers to testify at this time.
Thank you. Assembly members, would you like to give any final remarks?
Danielle Monroe Moreno for the record. Chair Marzola and committee, thank you so much for the opportunity to make this presentation. As I said on the floor, our children are watching, right? But our children are our future, and I hope folks are watching this hearing to see what dynamic young leaders we have in the two young ladies who presented today. So thank you, and we hope to earn your support for this piece of legislation.
Tegan and Carissa, would you like to give any final remarks? I will now close the hearing on Assembly Bill 215. I will now open the hearing on Assembly Bill 413. This measure provides for the creation of the Southern Nevada Healthcare Workforce Apprenticeship Pilot Program. Welcome. You may begin when you're ready.
Thank you, Chair Marzola, Vice Chair Harigi, and members of the awesome Labor and Commerce Committee. Commerce and Labor. Sorry, it's been a long day. For the record, my name is Ewing Wing. I have the honor to represent Assembly District 8. I appreciate the opportunity to come before you and present Assembly Bill 413. This will create the Southern Nevada Healthcare Workforce Apprenticeship Pilot Program. Joining me today to present AB 413 is Dr. Ricardo Villalobos, Chief Programs Officer of the Workforce Connection, and Chick McClellan, CEO of Innovative Workforce Projects. To provide you with background information, maintaining healthy communities throughout the state require proper preparation and a supply of a healthcare workforce. Nevada continues to see an increasing demand for services while experiencing significant shortages of qualified healthcare workers in virtually every healthcare profession, including medical assistant and pharmacy technicians. One pathway to meet these demands is a registered apprenticeship, which is a proven solution for recruiting, training, and retaining world-class healthcare talent. The United States Department of Labor reports in 2024 that there were 37,325 registered apprentices serving the healthcare industry, a significant increase over the last 5 years. Registered apprenticeships are effective blends of job-related instruction and on-the-job learning that are designed to equip apprentices with the required skills and competency for their occupation. These programs are successful because they are nimble, responding to the changing industry demands by gathering direct input from employers and workers to build the healthcare workforce of the future. With that, I will pass it over to Dr. Villalobos and Mr. McClellan to discuss what the Healthcare Workforce Apprenticeship Pilot Program will do.
Thank you, Assemblyman Nguyen, and thank you, Chair Marzullo, for the opportunity and entertaining this bill, AB 413, an apprenticeship program in Southern Nevada as a healthcare workforce pilot program. I'll start by just stating the fact that, or assuming that we're very well aware and know that we have an incredibly significant healthcare workforce shortage in the state. And in Nevada, as it continues to grow, the demand for healthcare workers and the professionals therein increases. A critical need for healthcare professionals, particularly in specialized fields like medical assistants and pharmaceutical technicians, exacerbates the issue. They're needed in healthcare clinics, doctor offices, mental health clinics, education systems, emergency services, veteran affairs, and et cetera. And as Nevada continues to grow, the need for healthcare professionals increases, particularly in these specialized fields of medical assistants and pharmacy techs. And albeit there are definitely other specialized fields in need of workers, our presentation today focuses on the need for MAs and PTs. In Nevada, the long-term statewide projections indicate that for medical assistants, there's going to be a need by 2032 of over 1,200 medical assistants statewide. For pharmacy technicians, statewide, there's going to be a need for approximately 600 pharmacy technicians. In Southern Nevada, as it continues to rapidly expand its population, specifically in Clark County, it faces a unique challenge in meeting the healthcare needs of its residents. As Southern Nevada grows, so does its diversity, its students, its communities, its businesses, its veterans, its law enforcement, its practitioners. And this program is an opportunity to serve them all. The long-term projections indicate for Southern Nevada that medical assistance has a need for approximately 1,000, 80% of the state's needs. For pharmacy technicians, it's a little over 400 that are in need, representing 73% of the state's need for pharmacy techs. And thus, the pilot to begin, we're hoping that it just begins in Southern Nevada based on the long-term projections. The challenges, I want to speak to a couple challenges noted, particularly in this area of workforce needs. There's 4 that I want to mention. One is the population growth that I just alluded to. There's a rapid increase in the region's population, especially with retirees and a growing healthcare demand. Secondly, the aging workforce. Many experienced professionals are retiring at a rate that's unprecedented, and we want to make sure to have the talent pipeline to fill the gaps that are going to exist in these particular fields. Thirdly, the training gaps, and this is by no means to undermine those that currently exist, but their capacity is limited, class sizes are limited, and moreover, the demand is just too much. And fourthly, we want to provide opportunities for our residents that live in Southern Nevada's rural communities, such as Lincoln, Nye, and Esmeralda, just to begin with. So at this point, I'll turn it over to my colleague, Jake McClelland.
Thank you, Dr. Villalobos. For the record, Jake McClelland, JakeMcclelland. So I just want to talk to you a little bit today just about the role of what an apprenticeship program is. I know many of you are probably familiar with the concept of registered apprenticeship as it's being used in other occupations, in particular the construction industry. But just to make sure that we're all on the same page, just wanted to give a little bit more clarity. Basically, an apprenticeship program is just an training model that combines some kind of on-the-job training that is paid while the individual is in the clinic, and it's combined with some kind of related technical instruction or classroom element. Sometimes in the healthcare field, it's referred to as didactic. But basically what sets it apart in an apprenticeship from your more traditional education models is going to be the fact that those two elements are combined into one streamlined process. So an individual doesn't necessarily have to decide between going into the workforce and going back to school, balancing work and school schedules, especially if they are a single parent or may have other kinds of family obligations. And so it just makes it really easy for them to participate and get that skill acquisition they need for a long-term demand career. Of course, along with that, the great thing about an apprenticeship, it does align training with actual workforce needs because apprenticeship is an employer-driven model, and therefore the employer is really deciding, especially with the on-the-job component, what exactly it is, the skills that are needed for folks in that role in their organization to be successful. So they are the ones designing that. It helps workers gain valuable hands-on experience from day one. It's an immediate employment opportunity for the individual, as I mentioned. Sometimes we hear the term referred to as the earn and learn model, and that's exactly what an apprenticeship is. Paycheck from day one while they complete their educational requirements. Apprenticeship programs have also been shown to reduce the time and costs associated with obtaining post-secondary education and other kinds of training after high school, as well as increasing worker retention and satisfaction. For the medical assistant occupation, just to kind of clarify what exactly that role is, we've all been to the doctor, so that individual that is that first point of contact that you see when you go see your primary care provider or specialist that helps take your vitals, helps prep the room, helps get some of your patient history and things of that nature. That's going to be the medical assistant. The benefits of an apprenticeship for medical assistants, I think I touched on previously, but really it's going to be that skill acquisition, getting that hands-on experience and in-depth training, that opportunity for immediate employment in the occupation that they ultimately want to end up in, and of course job security just due to the demand that Dr. Villalobos alluded to earlier. For pharmacy techs, these are the individuals that when you go to the pharmacy are going to be, again, preparing and dispensing medications under the direct supervision of a pharmacist. So these are going to be your primary points of contact when you go pick up your medications. Like with the medical assistant program, the benefits are going to be that hands-on experience that you get doing the actual job while you're learning it, the workplace integration that you get from becoming familiar with different workplace protocols, which ultimately improves productivity, and then that career advancement, an ability to gain an entry-level certification nationally recognized in the field that's going to allow somebody to eventually go on and can further their career in the healthcare sector if they ultimately choose to do so. I'm going to turn it back to Dr. Villalobos for the wrap-up.
Thank you, Jake. Again, Ricardo Villalobos for the record, and I apologize, I forgot to spell that out initially. It's R-I-C-A-R-D-O, Villalobos, V as in Victor, I-L-L-A-L-O-B-O-S. Again, just to reinforce a few things that Jake said about apprenticeship programs, apprenticeships are a cost-effective model to address healthcare workforce shortages. They create career pathways for individuals, so we see individuals starting on this path and then, with the intent to continue to further pathway opportunities. As Jake mentioned, provides education and training concurrently, simultaneously with that hands-on experience, creates self-sufficient individuals, and employers benefit from a qualified and trained workforce. I just want to lastly touch on the expected outcomes from this particular pilot. It's to focus on training 100 medical assistants and pharmaceutical technicians in Southern Nevada. Our aim, because of the data, is to focus on approximately 75 medical assistants and 25 pharmacy technicians in particular. Long-term benefits for Southern Nevada, it alleviates the workforce shortage for healthcare professionals. It contributes to our overall health in the region by providing skilled professionals for the fields, and it strengthens the local economy by job creation and workforce development. Lastly, I'll just conclude by saying that this apprenticeship pilot program aims to address ultimately the healthcare workforce shortage for these two particular fields of medical assistants and pharmacy technicians. The program is a proven solution to meet the growing demand for skilled healthcare workers, ensuring that we have a healthy future for our communities. Thank you very much.
Ewing Wing, for the record. Chair, if you allow, we would go over the conceptual amendment. Thank you. So the Section 1 would require the Southern Nevada Local Workforce Development Board or Workforce Connection instead of the Department of Business and Industry to develop, create, and administer the Southern Nevada Healthcare Workforce Apprenticeship Pilot Program to address the shortage of medical assistant and pharmaceutical technician in Nevada. The program must provide for the establishment of apprenticeship program in Southern Nevada for the training of medical assistant and pharmaceutical technician, which must be registered and approved by the State Apprenticeship Council, and money for the participant in the program to cover the costs of participating in the program, including fees for professional certifications and registration as applicable for not more than 100 apprentices who are enrolled in the program established under the program. And then Section 2 of the bill makes a $300,000 appropriation to Workforce Connection instead of BNI to carry out this program. With that, Madam Chair, we are ready for your questions from you and the committee.
Thank you for your presentation today. We will start with Assemblymember Kasama.
Thank you, Chair. Thank you for the presentation. I was just wondering why in the amendment you're taking it out of the Department of Business and Industry and making it a standalone board.
Yui Wing, for the record, through you, Chair, to the Assemblywoman.
You can go direct.
Thank you, Chair. Assemblymember Kasama, that was the original intent of the bill, but I think during drafting, there was miscommunication, so the incorrect agency was put, but the original intent of the bill was for Workforce Connection to be the agency for it.
Assemblyman Carter.
Thank you. So as you said in the beginning, that this is an employer-driven program, apprenticeships are. Do you have interest and buy-in from the medical and pharmaceutical community to be able to provide spots for these apprentices?
Jake McClellan for the record. So we are currently operating this program in 9 other states, getting ready to start with our 10th state here in a few weeks. As of right now, the reason why we brought this as a pilot program is because we do want to provide outreach to Nevada employers. We've had conversations with several in the region that are interested, but I think they're waiting to kind of see if there is going to be support for it.
Committee members, any additional questions? Assemblymember Hardy.
Thank you, Chair, and thank you for this bill. So just a little more, and you might have mentioned this, but so are you looking at, it says effective date of July 1st. So are you looking at this, the pilot program is 2 years, or like when would you want this to actually take effect, and then how long is the pilot program?
Yeah, the pilot program would be for 2 years. Oh, sorry, Jake McClellan for the record. Yes, the pilot program would be for 2 years starting on July 1st.
Committee members, any additional questions? I don't see any, so we will move to testimony in support of Assembly Bill 413. Is there anyone here in Carson City wishing to testify in support?
Good afternoon, Madam Chair and committee, and proud constituent of Assemblymember Yeager. I'd like to thank you for allowing me to speak. I am in support of this. My name, for the record, is Maria Teresa Hank, MariaTeresaHank, and I am in support of Assembly Bill 413. Thank you.
Good afternoon, Chair and committee members. My name is Reagan Hart. That's ReaganHart.
HART, and I'm with the Nevada Hospital Association. We are here in support of AB 413. This pilot program will strengthen Nevada's healthcare infrastructure by creating direct pathways for qualified medical assistants and pharmaceutical technicians to enter our workforce. We thank the chair and the sponsors for bringing this bill forward.
Thank you. Is there anyone else in Carson City wishing to testify in support? Please remember to state and spell your name for the record.
Sorry, I almost missed it. My name is Annie Vong, A-N-N-I-E, V as in Victor, O-N-G. We're representing Nevada Primary Care Association. They're in full support, and we could not have said it better than the bill presenters. Thank you.
Thank you. Anyone else wish to testify in support? I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
Thank you, Chair. We do not have any callers to testify at this time.
Thank you. We will move to testimony in opposition to Assembly Bill 413. Is there anyone here in Carson City wishing to testify in opposition? Don't see anyone walking up. I don't see anyone in Las Vegas. Broadcast, is there anyone on the line?
Thank you, Chair. There are no callers at this time.
We will move to testimony in neutral. Is there anyone here in Carson City wishing to testify in neutral? Don't see anyone. No one's in Las Vegas. Broadcast, is there anyone on the line?
Thank you, Chair. We do not have any callers to testify at this time.
Thank you. Assembly member, would you like to give any final remarks?
Just a very quick one. Ewing Wing, for the record, just want to thank you, the committee, to listen to AB 413, and I hope to get your support for this bill. Thanks so much.
Thank you for being with us this afternoon. I will now close the hearing on Assembly Bill 413. 1 minute recess. We will now come back to order. We will now start our work session. It is not customary for the committee to take testimony or otherwise rehear the bills during our work session. However, I may invite a witness to come forward for clarification or questions during our consideration of a measure. Before we get started, I just want to put on the record that Assemblymember Torres Fawcett is not in attendance. And with that, we will start with Assembly Bill 93.
Thank you, Chair. Assembly Bill 93 revises provisions relating to public employees. It was sponsored by Assemblymember Hibbets, heard on February 28th. The sponsor proposes the following 4 amendments: is to 1, add Assemblymember Monroe Moreno as a co-sponsor of the bill. 2 is to amend subsection 1U of section 1 of the bill to include any category 2 peace officer and any category 3 peace officer. Number 3 is delete subsection 2 of section 1 of the bill, and 4 is to amend the effective date of the bill to July 1, 2026.
Thank you. Members, are there any questions? I don't see any. I will entertain a motion to amend and do pass Assembly Bill 93.
Move to amend and do pass. Second.
I have a motion to amend and do pass from Vice Chair Howdigi and a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. I will assign that floor statement to Assemblymember Hibbets. Next is Assembly Bill 112.
Assembly Bill 112 removes an exemption from provisions providing certain employees with the right to use sick leave to assist family members. It's sponsored by Assemblymember Nguyen, heard on February 21st. There is one amendment proposed by the sponsor to specify that the provisions of the bill do not diminish an employer's obligation to comply with any of the following that provides the same or more generous leave and/or benefits under 1, a collective bargaining agreement, 2, an employer policy, 3, an employment contract, or 4, any applicable local, state, or federal law.
Thank you. Members, are there any questions? I don't see any. I'll entertain a motion to amend and do pass Assembly Bill 112. I have a motion from Vice Chair Howdigy, a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? Assemblymember O'Neill.
Chair, I'm going to vote to get it out of committee, but I want to look at it some more. I still think there needs to be some more adjustment to it. So I will reserve my vote on the floor if I may. Thank you.
Thank you. Assemblymember Hardy.
Yes, I'll just say ditto. There are just still some concerns with the bill, but we'll vote to get it out for now.
Any other discussion? All those in favor say aye. Aye. All those opposed say nay. Motion carries. I will assign that floor statement to Assemblymember Nguyen. Next is Assembly Bill 196.
Assembly Bill 196 revises provisions governing psychology, sponsored by Assemblymember Bacchus, heard on February 26th, and there are no proposed amendments.
Thank you. Members, are there any questions? I don't see any. I'll entertain a motion to do pass on Assembly Bill 196. So moved, Madam Chair. I have a motion from Vice Chair Howdigy. Is there a second? I have a second from Assemblymember Urick. Is there any discussion on the motion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries. I will assign that floor statement to Assemblymember Bacchus. Next is Assembly Bill 198.
Assembly Bill 198 establishes provisions relating to certain inflatable devices. It is sponsored by Assemblymember Brown May, heard on February 12th. There are several amendments listed in your work session document. Elliot Malin with Alpine Strategies proposes the following amendments. Number 1, amend the bill to add a preamble honoring Lizzie Hammond. Amend subsection 2 of section 3 of the bill to clarify outdoor recreation. Amend section 7 of the bill to require an operator business keep a logbook for each inflatable device for a period of not less than 2 years, and the logbook must be available for inspection at the request of any customer, user, or local or state agency. The fourth proposed amendment is to amend subsection 1B of section 8 of the bill to add that an operator must conduct an inspection of the inflatable device using any updates to the manufacturer's user manual or information provided in any recall of the inflatable device. The fifth proposed amendment is amend subsection 2 of section 8 of the bill to prohibit an operator from allowing any person to use the inflatable device if the inspection reveals or reasonable inspection would have revealed a hazard or potential hazard that would make use of the inflatable device unsafe according to the provisions of the bill, any manufacturer's user manual, or any update to the manufacturer's user manual or information provided in any recall of the inflatable device. The sixth proposed amendment is to amend subsection 2 of section 9 to prohibit the sale or transfer of an inflatable device by an operator unless, in addition to the conditions set forth in the bill, the operator provides to the purchaser or transferee any updates to the manufacturer's user manual or information provided in any recall of the inflatable device. Number 7 is to amend section 10 of the bill to require an operator to cease operation of an inflatable device if the wind speed exceeds 15 miles per hour. Number 8 is to amend section 11 of the bill to revise the requirements for anchoring an inflatable device to the ground. Number 9 is to amend section 12 of the bill to include additional information in the operator's warning sign. Number 10 is to delete section 13 of the bill. Proposed amendment number 11 would be to amend the bill to allow a local government to pass an ordinance with certain criteria and to use any portion of the fees collected for the issuance of business licenses by the local government to enforce the ordinance. Number 12 is to amend the effective date of the bill to January 1st, 2026. Matt Morris with Holland and Hart proposes the amendments 13 and 14, and that's to amend subsection 2 of section 3 to replace can be used with is intended for use. And 14 is to amend section 10 and 12 to make the maximum allowable wind speed the greater of 1, the recommendation of the manufacturer of the specific inflatable device in use, or 2, 15 miles per hour.
Thank you. Members, are there any questions? Assemblymember Anderson.
Thank you, Chair. As I look through these amendments, it appears that there are two that are in opposition or do not work with each other, and that would be number 9 and number 14. So just wondering what the intent of the chair was, if we would need to accept both of those, or if there's one that would be accepted instead. I might have the numbers wrong, but I know that there's an amendment for sections 10 and 12 and number 14, and then section 12 is also asked about in number 9. So just didn't know what how the chair wished to handle that issue.
We will have legal answer.
Thank you, Madam Chair. Sam Quas, Committee Counsel. I understand what you're referring to, which is the 15 miles an hour or less, and the second one is it's the greater of those two numbers, either the 15 miles an hour or the manufacturer's allowable. I can't remember the wording, but the intent of the work session document, because that or less language is in the existing law, is in the existing bill, the intent of the work session document was to lay everything out as they are in the attached forms. And so I believe the intent, if the committee were to pass this, would be to mesh these all together. And so it would be 15 miles an hour or the manufacturer's thing, the greater of those two numbers.
Thank you, Chair. So if I may ask then, I greatly appreciate that. I'm still not comfortable, though, with the greater. I personally like the less, but I might be the only one. So just wanted to put that out there. So thank you so much for that clarification as well.
Members, are there any additional questions? I don't see any. I'll entertain a motion to amend and do pass on Assembly Bill 198.
So moved.
I have a motion to amend and do pass from Vice Chair Jauregui. I have a second from Assemblymember Monroe Moreno. Is there any discussion on the motion? Assemblymember O'Neill.
Thank you, Chair. As I said before, and I appreciate my member from, I forget her district, I apologize. But the previous question, I'm going to reserve my right. I'll vote to get it out, but I'll reserve my right on the floor. I want to go over the amendments. There's several of them, and I'd like to have a little more time with them and talk to the bill sponsor. Thank you, Chair.
Assemblymember Cole.
Similar to my colleague, I'm actually going to be a no vote, and I believe we have a few others that will be no votes, specifically because there is conflicting language on the amendments, and there were some other concerns that we have. But we look forward to seeing the final draft and being able to hopefully vote yes on the floor. Thank you.
Any additional discussions? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Nay. We have a nay from, thank you for your hands, Assemblymember Kasama, Assemblymember Urich, and Assemblymember Cole, and Assemblymember Hardy. Motion carries. I will assign that floor statement to Assemblymember Brown-May. Next, Assembly Bill 202.
Assembly Bill 202 revises provisions relating to claims for dental care, sponsored by Assemblymember Brown-May, heard on February 12th. There is one proposed amendment by Paul Klein with Tri-Strategies, and that's to delete subsection 2B of section 1 of the bill and replace with is licensed by the Board of Dental Examiners of Nevada pursuant to chapter 631 of NRS.
Thank you. Members, are there any questions? I don't see any. I'll entertain a motion to amend and do pass Assembly Bill 202.
So moved.
I have a motion from Vice Chair Howdigy. Is there a second? Second from Assemblymember Cole. Is there any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. Motion carries unanimously. I will assign that floor statement to Assemblymember Brown May. Next is Assembly Bill 248.
Assembly Bill 248 ratifies the Physical Therapy Licensure Compact, sponsored by Assemblymember Marzola, heard March 14th, and there are no proposed amendments.
Any discussion on the motion? Or on Assembly Bill 248? I don't see any. I will take a motion to do pass on Assembly Bill 248.
So moved, Madam Chair.
I have a motion from Vice Chair Howdigy. Is there a second? I have a second from Assemblymember Monroe Moreno. Any discussion on the motion? All those in favor say aye. Aye. All those opposed say nay. Motion carries unanimously. I will assign that floor statement to myself. Our final work session bill is Assembly Bill 270.
Assembly Bill 270 revises provisions relating to professional engineers and land surveyors, sponsored by Assemblymember Hafen, heard on March 5th. There is two proposed amendments by Cassidy Wilson on behalf of the Professional Engineers, Land Surveyors, and Engineers Board. That is to amend subsection 1A of section 2 of the bill to replace 8 with 10, and amend subsection 1A of section 4 of the bill to replace 8 with 10.
Members, are there any questions on Assembly Bill 270? I don't see any. I'll entertain a motion to amend and do pass.
So moved.
I have a motion from Assemblymember Cole and a second from Assemblymember Carter. Is there any discussion on the motion? I don't see any. All those in favor say aye. Aye. All those opposed say nay. Motion carries unanimously. That concludes our work session. Oh, yep. Floor statement assigned to Assemblymember Hafen. That will conclude our work session for today. I will now open up for public comment. Please address your remarks to issues that fall within the jurisdiction of this committee. Public comment is limited to 2 minutes per person. Please remember to state and spell your name for the record. Is there anyone here in Carson City wishing to give public comment? I don't see anyone, and I don't see anyone in Las Vegas broadcast. Is there anyone on the line?
Thank you, Chair. The public line is open and working, but we don't have any callers at this time.
Thank you. Thank you, members, for today. This will adjourn our meeting.